Hi everyone, my name is Kathy Draper. I'm the Editor-in-Chief for the Lancet Regional Health Africa. Welcome from wherever you are joining in the world, whatever time of day it is. We're joining here from South Africa where it's the afternoon. Our aim today is to introduce you to our new journal as well as share practical guidance for preparing your manuscript for submission. And we hope you find the information useful and instructive, and we'll have plenty of time at the end to answer your questions. So to give you a little bit of an overview of what the webinar is going to entail, I'll start off with some housekeeping details, then share about the journal. We'll talk about essentials for preparing your manuscript, our editorial processes, and then Q&A at the end. So some housekeeping. You're welcome to submit your questions throughout the webinar using the Q&A box on the webinar dashboard. Also on the dashboard, you'll find a related resources box with links to helpful pages on the lancet.com, including our journal's About page, where you can find out more about the journal, and to our author resources page, where you can find useful information and documents to help ensure your publishing experience with us is as seamless as possible. If you wish to turn on closed captions or translations, please click the CC icon in the top right-hand corner of the webinar dashboard and select your preferred language from the options that are provided. Please note that the captions and the translations are automatically generated and may not be entirely accurate. Once the webinar has ended, you'll receive a link via email to the on-demand version, which you can watch at your convenience. And at the end of the webinar, please do complete our short feedback survey, which helps us improve our webinar offerings in future. Joining me today is Hlengiwe Madlala, our senior editor. We handle all the editorial tasks of the journal, including managing the peer review process. I'd like to share a bit about our background so you know who we are. I joined the Lancet Group in September 2025 and am based in Cape Town, South Africa. Prior to starting as the Editor-in-Chief of Lancet Regional Health Africa, I held an associate professor position at the University of the Witwatersrand. I have a master's in research psychology and PhD in public health, both from the University of Cape Town, where I also completed my postdoctoral research fellowship and worked as a senior researcher until 2017. In my previous academic work, my research interests included implementation science, qualitative research methods, and early childhood development, as well as maternal and child health, all in South Africa. I'm passionate about doing research that can contribute to social change, especially at community level. Hlengi is also based in Cape Town, South Africa, and prior to joining the Lancet Group, also in September 2025, she worked at the University of Cape Town for 10 years, starting as a postdoctoral fellow in the Department of Human Biology, and progressed through several research and academic roles before becoming a senior lecturer in the Division of Epidemiology and Biostatistics. Hlengi has a PhD in medical science, MPH in epidemiology and biostatistics, and an MBA. Her research interests include maternal and child health, HIV, and cardiometabolic disease. We work collaboratively and are supported by colleagues and teams globally. Our editorial assistant is Carly Bednar, who's based in London. If you have any additional queries that we're not covered today, we'll be pleased to help. So email us at africa@lancet.com and we will respond to you as soon as we can. Before we get into the more practical aspects of the talk, we'd like to introduce you to our new journal. The Lancet Regional Health Africa was launched as part of the Lancet Regional Health Global Initiative to advocate for healthcare quality and access in all regions of the world. We aspire to promote the advancement of clinical practice and health policy in Africa with the goal of improving health outcomes for all people. We aim to give voice to regional researchers and regionally relevant and impactful topics and help to increase the quality of research in African countries and across the region. We will publish content online, so online first, and in monthly online issues. We publish a range of content types, including articles, reviews, comments, perspectives, correspondence, and editorials. And all of this information about these article types is available in our information for authors. The journal is a gold or fully open access journal. All content, including reviews and comments, is published under a gold open access license, but the article processing charge, the APC, only applies to full-length articles that are peer-reviewed. And as per Lancet Group's policies, authors who do not have institutional or funding body support for APCs, we do offer discounts and waivers as standard. So all content in the journal is immediately and freely available online to anyone and published under Creative Commons license, which enables our authors to retain copyright of their work. We believe the ability to pay should never be a barrier to publication, and as already mentioned, there are several options, including waivers and discounts available to authors to support publishing fees. Our journal covers a wide range of disciplines and topics that are relevant for the Africa region, and we invite submissions that include, but are not limited to, infectious diseases, non-communicable diseases, child and adolescent health, maternal and reproductive health, mental health, injuries and trauma, climate change, health policy, health systems, and health equity. Also want to speak about the Equitable Partnership Declaration. This is a statement that is published online alongside relevant original research papers at the Lancet Group to allow authors to describe how their work engages with researchers, communities, and environments in the locations where studies take place. This statement is part of our broader goal to decolonize global health, handing control and leadership of research to academics, clinicians, and affected communities who are based in the locations of study. This declaration, the EPD, is provided by the author group as a form that is published as an appendix alongside the final article. We request this form be completed for appropriate articles when we request a revision after peer review rather than at submission. And in completing the form, we ask authors to attempt to answer in as much detail as possible. And the introduction of these equitable partnership declarations was first announced in a comment in the Lancet Global Health, and more details about this declaration are in the paper that's provided there. And while the equitable partnership declaration was initially intended for authors outside of the countries of study, for our journal, we're asking all authors, even if they're from the country of study, to complete this as well, because we believe that equitable partnerships apply across all of these settings. So our International Advisory Board consists of key opinion leaders and researchers from around the world who lend their expertise to the journal. The board offers us subject, academic, and geographical advice on an ad hoc basis when we request it. Board members have no formal involvement in content selection or in any part of the peer review process, nor do they have editorial oversight of any section of the journal. However, board members are occasionally invited to peer review individual submissions at our requests. And any submissions that are authored by members of the board are handled by our editorial team according to our standard peer review processes. These are the other members of our International Advisory Board, and you can see more information about them on our website. So I'm now going to hand over to Hlengiwe to talk about essentials for preparing your manuscript.
Thank you, Kathy. Hello, everyone. Thank you for your interest in our journal. So as mentioned, I'm going to talk about essentials for preparing your manuscript. These essentials are not unique to our journal, but they actually cut across all other Lancet journals. When you have submitted to any other Lancet journal, whether you've submitted or not, you need to go through this information for authors document. This is to help you for preparing your manuscript. This document has comprehensive information on these 9 items, such as the different article types and their word limit, the number of tables and figures that are allowed, the different forms that are required, as well as the links to various reporting guidelines and checklists that are used for different study designs. You can find this document on the Author Resources section on our website, and the link to it is included for you here on the slide. For papers submitted to the Lancet journals, we require a research in context panel. This panel is frequently overlooked by the authors, which usually results in incomplete submissions that we often send back to them. So ensure that it is included in your submission. The panel has 3 parts. In the first part, the authors need to summarize the literature evidence and related gaps that prompted their study or their analysis. In the second part, the authors must state the added value in terms of novelty. And then in the third part, they must discuss the implications of all available evidence. Essentially, this panel helps the editors, the reviewers, and the readers to understand how your study contributes to the broader body of knowledge and its implications for policy or clinical practice. More details of what's required under each subheading of the Research in Context panel are provided in the document with information for authors, which I've just mentioned in the previous slide. Shown here is the general structure of an original research paper. So next, we are going to go through some tips for writing these sections. The title is the first thing that a reader sees, so it should attract the reader's attention. If the title is not an accurate description of your work, then the right people may not read it, and this would potentially result to lower readership and citations than what the paper deserves. The title should be concise and should directly reflect the content of your manuscript in terms of the study population, the location, and the study design. And the title should be non-declamatory. In other words, it should not give the answers to the research question or an interpretation of the findings. It's also best practice not to use technical terms or abbreviations in the abstract. Although the abstract should be written last, it is everyone's starting point when they are searching the literature. Therefore, it is a critical part of all papers as it provides a highly visible overview of your work. As with most medical journals, the Lancet journals require a structured abstract with subheadings as shown here. In each section, ensure that the description accurately reflects what was done as well as the data. As much as possible, try not to use abbreviations in the abstract. In the background section of the abstract, you need to ensure that the aim is clearly stated. In the findings section, you need to give the characteristics of the population that is under study, including proportions by disease of interest, by gender, and ethnicity, if this is applicable. Next, and most importantly, you should report the results for the primary aim or the primary outcome, and ensure that you include precision values for the estimates that you are reporting, like the 95% confidence interval. In the interpretation section of the abstract, you should concisely tell the reader the implications of your findings on clinical practice or policy without overselling the results. Overall, remember that a clearly written abstract will encourage the reader to go ahead and read the rest of your paper. Next is the introduction. This section should address these 3 questions. Where does the field currently stand? Which is the background to your research. And then what is the gap that your study is addressing, followed by the specific aims. In this section, it is important not to leave relevant studies for the discussion in an attempt to emphasize the novelty of your study. For example, if something similar was published as you were writing up your paper, this needs to be included here. For the methods, all aspects listed here are important to include. To help you not miss any items, you should use recognized guidelines for reporting, such as a consult template for clinical trials, a stroke for observational studies, and Prisma for systematic reviews. And you must include the completed templates in your submission as an appendix. The usual subheadings in the methods include study design, participants, procedures, statistical analysis, and the role of the funding source. Under participants, it is important to state the inclusion and exclusion criteria, as well as the setting from which participants were recruited. You need to also include the name of the ethics review board, the approval number, and whether participants provided written informed consent if this is applicable. Under procedures, you should state who collected the data for the outcomes, what tools or instruments did they use, were these tools validated in the current population, and how each outcome was defined. Under statistical analysis, you need to provide information about how outcomes were analyzed and what software was used for the analysis. Throughout the methods, you should be as clear as possible while providing enough detail so that anyone applying your methods can easily repeat what you have done. In the results, it is important that each result reported can be linked back to the methods and vice versa. Otherwise, the readers will be very confused. You need to provide absolute numbers together with percentages and not just percentages alone. For all other measures, you should include precision values like your standard deviations, interquartile ranges, and 95% confidence intervals. You should clearly label any post-hoc analysis as such and describe all adverse events if this is applicable to your study. Most importantly, do not reiterate all the data presented in the tables and figures. Instead, you should just summarize the results and refer to the outputs in a sequential order. Interpretation of the results should be avoided in this section. The discussion is where you interpret the meaning of your results. In fact, this is where you get a chance to sell your research without going overboard, of course. The first paragraph should summarize the findings, and the subsequent paragraphs should then discuss these findings in the context of previous studies. Make sure that the discussion corresponds to and complements the results, but do not simply repeat the results here. When comparing your findings with previous studies, it is important not to ignore studies that are in disagreement with yours, but rather confront this by discussing what you think could be contributing to the observed differences. Of course, we know that everyone would like to think that their work is perfect, which is sometimes makes researchers hesitant to discuss their study limitations, but we encourage you to critique your own work and to be transparent. Then you should conclude by stating the public health implications of your findings and future work that is still needed. Throughout the discussion section, be careful to avoid statements that go beyond what the results can support. This is the list of subheadings that should be included at the end of the paper. Under contributors, you should indicate who had access to the raw data, who verified the analysis, and who takes the responsibility of the decision to submit the manuscript for publication, among other contributions. The declaration of interest statement must match the submitted conflict of interest forms that are signed by each author. You should also include a data sharing statement and acknowledgements. For references, try to keep to the limit of 30 for original research articles. Once you have constructed your paper and you are about to submit it, you then come to the cover letter. Although there are no hard and fast rules here, my personal preference is to keep the cover letter brief, ideally no more than a page. Instead of reiterating the entire abstract, use the cover letter as an opportunity to provide the editor with any relevant information that they might need but is not present in the paper itself. For example, in no particular order, indicates if the submission is in response to an invitation or a call for papers on a certain topic, or if you had a pre-submission discussion with the editor. Mention whether the submitted work has been accepted for a conference presentation, so we can align the publication timeline as closely as possible. Also do mention it if the findings will inform pending policy decisions. You should still state the findings and the importance of the study, but be very brief. Also mention why your paper is the best fit for our readership and whether it's been peer-reviewed elsewhere. As you can see from these items, a cover letter should not simply repeat the abstract, so use it thoughtfully. I will end with some general tips for writing a paper. You need to ensure that you report your findings accurately and that your interpretation is not too strong. We know that it's tempting to demonstrate that your work has potential to change practice, but reviewers can be put off by overinterpretation and cherry-picking of the findings. You also need to ensure that the flow of your methods and results is logical and consistent throughout. Another critical tip is to ask a colleague to read your paper, preferably someone outside your field of expertise. If they have difficulty understanding the paper, then there is a good chance that the editors and broader research community won't understand it either. Related to this, at the Lancet, we always strive for clarity in reporting, so tell your story in a simple and concise manner so that it can be understood by a broader readership, as not all readers will be experts in your field. If there are field-specific technical terms that you cannot avoid, then define them at first mention. Final note on submissions. Please ensure that you thoroughly go through the information for authors document found on our website, as there is useful information to guide you through your write-up. I will now hand over back to Kathy to talk about our editorial processes.
Thanks very much, Hlengiwe. So I'm going to talk a bit about the editorial processes. So each manuscript submitted is treated individually, but most research papers follow a similar path from submission through editorial and peer review to production and publication and beyond. So these are our core tasks as editors. So selecting manuscripts for the review process, reviewer selection and overseeing the review process, making final decisions on manuscripts, various article quality and journal policy checks, and support for achieving the impact published papers deserve. So in addition to overseeing manuscripts submitted for our consideration, we also commission and edit linked comments and reviews and write editorials. And our everyday tasks include assessing manuscripts submitted to the journal, where we collaborate with fellow Lancet editors who provide feedback on papers as part of our internal review process. Then we decide which manuscripts to take forward for peer review, which I'll cover in more detail shortly. We identify and invite appropriate external peer reviewers to our rigorous peer review process, and we then oversee the peer review process for each manuscript with peer reviewers and authors, and we then make the final decision on whether to reject, publish, or offer a transcript to another journal for each manuscript. The editor-in-chief is the final arbitrator of all decisions for each of the Lancet journals. For example, the decision to take a paper to peer review, the decision to publish or reject in light of the peer reviewer's remarks, journal scope and commissioning, consideration of appeals, general inquiries, and editorial priorities at any given time. Throughout each stage that a manuscript progresses, we conduct quality checks and ensure alignment with our policies in close collaboration with our teams of technical and production editors, illustrators, designers, operations and product managers, and editorial assistants, all dedicated to supporting your efforts to advance health worldwide. We work in close partnership with authors to check the paper and analyses, put the findings into context, and ultimately improve how clearly the message is communicated towards achieving the impact a paper deserves. So editors collaborate with colleagues in marketing and communications, multimedia, and product management to ensure papers we publish are highly visible to a global network of fellow researchers, clinicians, industry professionals, policymakers, media outlets, patients, and the wider public to maximize the impact of your research on the world. Our team manages our LinkedIn accounts. We host our In Conversation with podcast, which will be launching soon. And we directly engage with research and policy communities, such as attending and participating in conferences and policy briefings and conducting institutional visits. So decisions are made by us, the editors, and can be made at all stages of the review process, so either at submission or after each round of review. And we base our decisions on whether to reject, offer a transfer to another journal, or accept manuscripts on relevant thresholds. So I'll go through some of the main ones that we consider. So firstly, we want the paper to be conceptually novel and of importance in its own field. We take very seriously the meaningful inclusion of local authors. And what does that mean? So meaningful inclusion is not a minimal number of local authors or local authors somewhere lost in the middle of a long list of authors, but preferably either as first and or senior author, and we are flexible around joint authorship. And we understand that many researchers from other countries do research in Africa, but as part of our effort to give a voice to the region, we really want to encourage authors to consider how they are including local researchers, and even for African colleagues who've moved out of Africa and working in other countries, to consider what is ways that they can still connect with the region, either through joint affiliations or partnering with local researchers as well. And happy to talk more about that in the Q&A. We look at methodological rigor, so as a study done rigorously, and linked to that, we look at the study design. And so there's certain study designs that we are particularly keen to receive, like randomized control trials or large studies done in multiple sites if possible. So we take that into consideration. We want to make sure that our papers have an interest for a general audience. So papers that are on a very niche topic that affect a very small percentage of the population may be not as easy to prioritize in light of other content. We want to ensure that submission has wider importance and relevance for the region, both in terms of policy and practice. There needs to be strong logical support for the conclusions made. We need to see contextual insights, and that's really where regional and local authors come into play, that if you're including people from the countries of study, they are able to help provide those contextual insights. And we want to publish work that will inspire further research and not just replicate what's been done before. So we also take into consideration our current pipeline of submissions so that we can balance as far as possible the content that's sent for review across different disciplines. And I mentioned many of those disciplines that we do cover, and try and make sure that we have a spread across those where we can. So peer review is a rigorous process that plays a very important role in ensuring the integrity of the scientific record. At the Lancet, a total of 4 independent peer reviewers are invited. 3 of those are subject or clinical experts. For some papers, if we have more reviewers that take up the invitation, we'll have more than 4. And these experts are selected to cover all aspects of the paper, particularly if the paper is covering an interdisciplinary or multidisciplinary topic. We try and make sure that we get a spread of those. We want these to be unbiased, balanced, and objective referees, and we avoid recent co-authors, PhD supervisors, or close colleagues. And the journal is very intentional about diversity and inclusivity. So for these 3 reviewers that we select, as far as possible, we aim to adhere to this in terms of gender and geography so that we get balanced reviews. So for Regional Health Africa specifically, we invite 1 local from the country of study, 1 regional from another African country, and 1 global to ensure that work published remains globally relevant. The 4th reviewer is a statistical expert that critiques the statistical methods used if it's a quantitative study. And depending on the study design, we can also invite modelers, data scientists, health economists, or people with lived experience. For qualitative and mixed method submissions, as well as scoping and narrative reviews, we invite a 4th reviewer that has content and methodological expertise. So our editorial teams, for authors whose work progresses through both internal review and external peer review, congratulations, you're now closer to publication. And these accepted articles are then checked for technical elements, sub-edited for grammar and clarity of scientific meaning. They're formatted to our house style using specialized publishing software to create a version of the intended print page, and reviewed by in-house illustrators to ensure illustrations, tables, and graphs adhere to the journal style and convey appropriate meaning and interpretation. So our editorial teams work closely with our authors and our technical, editorial, and production teams to format the manuscript into the best possible paper. And alongside research articles, we might commission a linked comment in which an independent expert provides an outside perspective and helps explain the work in the broader context of the field. So Lancet journals are both a destination for publication and a platform to advance the global impact of research. The Lancet Group cares that work is highly visible to a global network of researchers, clinicians, industry professionals, policymakers, media outlets, patients, and the wider public. And we work with you and authors and our affiliated institutions to maximize the impact of research, the research published on the world. When the final content is ready, the paper is scheduled to publish with both the designed PDF and an online version on the Lancet.com and Science Direct, where we have extensive global reach with over 40 million annual visits. For authors presenting their original research at conferences, as Hlengiwe mentioned, our editors will work with you to try and coordinate simultaneous publication under embargo, which can be further supported by our bespoke alerts program with over 4 million subscriptions. The Lancet Group journals have millions of followers across major global social media platforms, from LinkedIn to Blue Sky, Facebook to Instagram and YouTube, as well as WeChat, Weibo, and RedNote in China. And research published in Lancet journals receives regular coverage in influential media such as the Associated Press, BBC, CNN, Financial Times, The Guardian, The New York Times, NPR, and The Washington Post. And our journals also offer podcasts available wherever you listen to your favorite podcasts. The Lancet Group considers its responsibility for scientific integrity as extending beyond publication via the responsible communication of research findings, striving for accurate and fair representation of research beyond the pages of the Lancet journals. All Lancet-produced materials supporting the communication of research findings, such as press releases, social media posts, multimedia, will seek to present a fair and accurate summary of the research with the relevant context provided. Research invites debate, which is encouraged and often published in our issues over the weeks and months following publication. We continue to monitor the impact of science, we publish, encourage follow-up studies, track developments in the field, and to champion the application of valuable knowledge for real-world change. So that is all that we are going to present, and we're now going to move to the Q&A section of the webinar. Okay, so we have a large number of comments that have been posted in the Q&A box. So find the start of them. So some I will answer specifically, and some provide some more general answers. So one of the questions relates to whether the data needs to be from Africa. So at the moment, our focus is on publishing research that is done in Africa on African populations based in Africa. This may change in the future in terms of African diaspora around the world, but at the moment, we are prioritizing submissions that are based on African populations. And to clarify as well, that the region that we focus on is the WHO Africa region, which is predominantly sub-Saharan Africa. A new regional health journal is also in the pipeline that's focusing on North Africa and the Middle East. That's been Lancet Regional Health, Eastern Mediterranean. So some of the questions have been about countries in North Africa, and those would be best placed in the new Eastern Mediterranean Regional Journal. There's also a question around impact factor and whether this is the same for the Lancet and the Lancet Regional Health Africa. So each journal has its own impact factor, and so we need to build up that track record over the next year or so to work on reaching those metrics that are used to actually determine the impact factor. So we would love to have the same impact factor as the Lancet Weekly Journal, but ours will be determined based on our journal's track record, and we're doing whatever we can to make sure that we can attract high quality content that's highly citable that can then contribute to a strong impact factor. But these things do take time because a track record does take time. There's also a question around whether we publish articles on biomechanics. And I'll answer this question in relation to other disciplines. So as we mentioned, a number of disciplines, which was not an exhaustive list, but there may be other topics, but we would need to see a particular health outcome. And again, we would look at what is the study design. So if it's a smaller scale study or cross-sectional or survey study or done on a small sample, those are some of the considerations that we would take, but we would need to make sure that it was anchored to a clear health outcome or health issue. There's also a question about qualitative research and mixed method studies. So we are considering these submissions as well. Traditionally, qualitative and mixed method studies are not haven't been published as frequently in the Lancet Group Journal. So we do have quite a high bar for these studies, and we know that many great research projects include these kind of methods. At this stage, we are looking at larger scale studies that particularly have, say, multiple sites, or where qualitative research is used as part of an implementation science process or a co-design process, or mixed methods in terms of combining with other methods such as a document review. So we do consider those, and probably the best route is, if you're not sure if it fits, is to send a pre-submission query to africa@lancet.com, and that will get received by Carly, our editorial assistant, and she will pass that on to us, and we can provide some more detailed feedback. So there's also a question around building citation influence and scholarly authority within the global Lancet ecosystem while remaining authentically region-driven rather than impact factor-driven. And so, linked to what I mentioned earlier, we do want to build up that strong track record. Impact factor is not the be-all and end-all, but it is a very important consideration for many authors, for many institutions where research is published. And so we want to make sure that we're doing what we can to reach those metrics. And that's part of what the balance of these regional health journals is. It's working within the broader Lancet ecosystem that has this standard of high quality, rigorous research, but also research that has a large impact, but also providing that regional voice and regional perspective. So Hlengiwe, I wonder if I can pass on to you. There's a question about knowing that publishing in the Lancet is difficult, and how do we demystify that perception? If you'd like to take that one.
Yeah, sure. Yeah, so I mean, I think anyone who is able to come up with a compelling research question that is relevant for the region, a study that uses rigorous methods and transparent methods, and if you are able to clearly articulate the policy or clinical relevance for the region in your study, then your submission would likely be sent out for peer review. So we don't look at the track record for your publications, for example, as long as the piece is clearly written, it has some novelty, the relevance for the region is very clear, and the contribution to policy or clinical practice, then yeah, it's likely to be successful in terms of being published in our journal. And I see there's a question on the average time that it takes for article from submission to publication. So for this one, there's no direct answer, but for new submissions and transfers from other Lancet journals, we usually aim to make a decision of whether we're going to send the paper for peer review or not within 2 days. So if it's a desk reject, we communicate that quite quickly. So if you don't hear from us within 2 working days of submitting, then it's a good sign. And then for those manuscripts that we do send out for peer review, we usually aim to invite reviewers as soon as possible, usually within a day. And then from there, the time taken depends quite a lot on finding the peer reviewers and getting back the reviewer reports within the given deadlines. We typically give 10 days for reviewers to submit their reports, but there's usually requests for extensions. So we aim to have all the reports and make a decision of whether we invite a revision or not within a month or up to 2 months if there's delays. If we do invite a revision, then from there, we give 21 days for authors to work on those revisions, which often times we would send back for re-review again. So yeah, again, not a clear answer, but within a month or 2, you should have the first decision if your paper was sent out for peer review.
Okay.
And then I see there's a question asking why in the findings I talked about real numbers and not percentages. So the requirement here is that both are presented in the paper, so both absolute numbers and percentages. And this is because if you just present a percentage only, if that percentage is from maybe 5 people, it will need to be interpreted cautiously than if the absolute number is quite big. So we require both, not just one of those. Yeah.
Okay, thank you so much. You've hit a number of them all in one go. There's another question about balanced representation of different African regions on the editorial board. So as we mentioned, we don't have an editorial board. All of the editorial processes are handled in-house for the journal by myself and Hlengiwe. Our advisory board plays an advisory role. And so in selecting that advisory board, we were very intentional about ensuring coverage across different countries, across different disciplines. Can we cover all countries and all disciplines in one go? No, but the advisory board is refreshed every few years. And so where we feel that we need additional expertise on certain things, we will reach out and invite those individuals when we do refresh the advisory board, and to ensure that that we get good representation across the regions. We're aware that we make a lot of effort to be inclusive of Francophone and Lusophone countries, and so that's something that we will certainly intentionally work on going forward. So there's some other questions about bibliometrics, and I think I've covered that. So we need to, publish our issues and get that out, and then the metrics are based on our publication track record. Then
there's a question on comments. So the question is that we currently have comments online. What about other types of studies? So we definitely take different types of studies that Kathy mentioned, like original research articles. So those will be coming up on our first issue, which will be available in about a month's time. That's where all the other research types will be available. And then from there, from our first issue that we're going to publish in March, from there onwards, then we'll have monthly issues that will have a range of different types of articles.
Yeah. There's also a question around whether we have a manuscript template. So we don't have a specific template, but obviously have a look through the information for authors to get guidance on the different sections to include. And as a guide, generally, formatting is an important way of, making your manuscript easy to read. So it's an important consideration to make sure that the formatting is consistent and really clear. Our editorial policy regarding AI-assisted writing and review, that's another question. And we ask that all use of AI is declared at submission. We understand that there's many tools that help researchers around language and grammar, and we see this as particularly helpful for authors whose first language is not English. But essentially, we don't want AI to replace what the researcher should be doing themselves as a researcher. We understand that there's all sorts of things that can be used, and we are, vigilant about keeping an eye out for that, and that it's not replacing the task of what a researcher should be doing, and increasingly need to be vigilant about how we pick up on those things. So that's very much an important consideration for us. A question is there around whether we consider scoping reviews. We do consider scoping reviews. Again, it should be important that the methodology is done really rigorously and explained well, and justified why for a particular topic is a scoping review more appropriate than a systematic review. We understand there are many topics in Africa where there isn't available research, and so scoping review is the appropriate method, and so that's important for that to be clarified.
Yeah, and there's a question about whether we accept unsolicited comments. Yes, all of the comments actually that we've published so far have been unsolicited, and the word count is 750 words for comments.
Thanks. There's a question as well about whether you can submit a paper as an independent candidate or should you be affiliated with an institution. I don't think we have a hard and fast rule on that, but generally research is a collaborative process. And so it would be typical to expect that even if you were an independent researcher, that you would have some affiliation, whether that's to an organization. We have some authors who are affiliated to government departments and obviously then academic institutions. And so that across the group of authors, that there would be good representation in that way. And what is particularly important, though, as well, is if you are working with patients, with participants, an ethical approval is required, which it is, across those kinds of studies, then it's important that that approval is obtained through an appropriate institution. So if you're an independent researcher who's working with participants on a research project but doesn't have access to an institutional review board, then you would need to make sure that you included someone with an affiliation in order to get that approval. And in terms of feedback on rejections, so for the desk rejects that Hlengiwe mentioned, which we do try and do quite quickly, unfortunately not able to provide feedback on all of those, but whatever comments are received from peer reviewers are provided for the authors.
Then there's another question about whether there's a chance that a single country study can be accepted. Yes, definitely. Obviously, we prefer like a very large sample size study. So maybe if it's in one country but different recruitment sites, that would still be eligible. Like we would still be interested in that. As long as the research is relevant and the conclusions can be generalized to other similar settings in the region, then we would be interested in that.
Thanks. I'm going to answer a question about how long on average from submission to first feedback. Well, Hlengiwe's answered that already, but then from first feedback to subsequent publication. So similar to how long the peer review process takes, the feedback to subsequent publication, if successful, is also very dependent on how quickly the authors are able to respond to comments, if it's needed to send back to reviewers, if they're willing to review the revision, how long they take. So ideally, that could happen, within a month or so, but sometimes depending on delays in different parts of the process with the authors and or the reviewers, that can take longer. And as Hlengiwe mentioned, our first issue is coming out next month. And once we start publishing the issues, all articles that are accepted will become available online first, and then will get included in a later issue. But that's part of our publishing model, is that once they're accepted and they've moved through production, they're available online, but then will be bundled into an issue later. There's also a question about, do we publish practice papers of interventions implemented on the continent? So we don't publish descriptive papers that describe an intervention or methodological papers. So there would need to be reporting on an empirical research process. So that can be quantitative or qualitative, but purely just describing is unfortunately not something we'd be able to prioritize. But if there's an evaluation of an intervention, that's certainly something we could consider.
Yeah. And then there's a question whether we publish articles on environmental health. So if that is linked to public health, then definitely we have a few papers on climate change and health, and that's one of the topics that we're quite interested in.
Okay. There's also a question about, if a study's been conducted in Africa, but the corresponding author is not from Africa, will this paper be eligible for publication in the journal? So yes, it would be, but we would look and take into consideration whether there were local authors included. So if the corresponding author and all authors were from another country and there were no authors from the country of study, then that is something that we would not consider, but we would consider on a case-by-case basis the inclusion of local regional authors. Some authors have dual affiliations, so perhaps they've moved to another country, but they still have an affiliation at an African institution. So those are things that we take into consideration. And as part of promoting equitable partnerships and making sure that we are a voice for the region, so from local researchers. There's a question around the cost of publishing. So there's currently a waiver on the article processing charge that we can now confirm has been extended to the end of September 2026. So that's for anything submitted before the end of September, not published. Thereafter, the article processing charge will be $750. But as I mentioned in the presentation, there is a waiver program, so we don't want that to be a barrier to publication. So if there are any requests for an APC waiver, those should be submitted. There's also a question around the chance of single country research.
Yeah.
We've covered that one.
There's one on whether we publish neglected disease, if we will be interested in those. Yes, we would be interested in those, including nephrology studies as well. So anything under health, basically, we would be interested.
Okay. There's also a question about how we've promoted the journal within Africa. Will we be doing podcasts on each edition? So our approach at this stage for the podcast is that we're going to focus more on topics. So in some cases that might be linked to some of the published content, but it's not necessarily going to be just about each monthly issue. And in terms of how we've promoted the journal within Africa, so where we have been able to, visited different institutions, attended conferences within the region. And so that's part of our outreach activities. And so when we are attending a conference somewhere, we look for opportunities to connect with our international advisory board members if they're located there, meet with other academics, other institutions, research institutions, in that location. So we try and maximize the opportunity. Obviously, travel is expensive, so we want to look at other methods as well. And so this webinar is one of our key ways of promoting it. And we've shared this message with different institutions, with our advisory board members, and encourage them to share with their networks as well. And obviously our LinkedIn page as well is a way through social media that we can also promote through Africa. If you have a network or a suggestion of how we could do this better, we'd be really keen to hear that. So please do also email us at africa@lancet.com and share any ideas that you have. Yeah, there's a question about systematic reviews. Hlengi, do you want to take that one? Do we publish them? Do we have guidelines?
Yes, we publish systematic reviews. The guidance, we had a link on the slides to the information for authors for those. We take both the ones that have meta-analysis and those ones that don't have. We're definitely interested in those. And related to that, I saw another question about whether we take systematic reviews that are from one country. Yes, we do. So for those, we just see how many studies are included, like in the final review, and if it's a good number, then we would consider those as well.
Okay, there's also a question about how recently should the study have been conducted. So this is a complex one with not a simple answer, but obviously given the high number of submissions that we do receive, the age of the data is a consideration that we look at as well. And, depending on the topic, I don't think there's a one size fits all. There might be some topics where, data just has not been available. And so the only available data might be old. Generally we want to be looking at data that's collected, within the last 3 to 5 years as a guide, but, that's not a a hard and fast rule, but it needs to be in relation to the research question or the topic. You know, have there been any significant changes? So if the data is from 2020, have there been any significant changes that have a bearing on how that issue or that research question or topic might have changed since then? Obviously, COVID is, you know, the impact of the pandemic is something that comes to mind. So the age of the data is a consideration that we take into account.
Yeah, and then there's another question on whether our reviewers are only from the region. So yeah, as Kathy mentioned in the presentation itself, preferably we require 2 from the region, 1 from the country of the study, if it's a single country study, and then second one from any other part of Africa, and then the third one should be from any other international country, because we do want to make sure that as much as our journal is focusing on the region, but the content that we publish should still be of global relevance. So yeah, they're not necessarily only from Africa.
All right, so we have reached time, and I know we didn't get to all the questions. Some of them covered similar topics. I'm hoping that we covered those, but we just really encourage you to have a look at our website, have a look at our information for authors to get some more information. The website address is provided there. And if you have any specific questions for us, please do get in touch. And thank you again for attending. And yeah, we look forward to working with many of you over the coming years. Thank you.
Thank you.